Hello everyone, this is Dr. Khan, Executive Plastic Surgery, Bloomfield Township, Michigan. So another very interesting case. This is a nice 47-year-old patient, comes to me with a set of implants, two of which the first one was in 2001 saline. And then she ended up having them removed in 2008 and ended up getting silicone implants. So as you will see down here, you have what is end block removal on the right side. I cut out the excess skin. Full thickness. This really helps with the contouring, the pseudo lift, and kind of help mobilizes the breast tissue up medially and superiorly. So as soon as I go in, I encounter what is this suture material. And looking at it, this is a probing suture right here, and you can see it. It winds all the way around. As you can see, if I go like this, and you know what's interesting is it's in the close proximity to the implant, and it is a nice size one. So what I'm going to do is I'm going to see if I can cut it out. And the other thing is she had from history what is allergy. See, if I pull on this, you can see how it pulls on the tissue around. So you can see how much stress it can put right on the implant, which is right next to it. So I'm going to cut this out, and I'm going to spread this out. So end block, the gold standard, below the muscle, silicone implant from 2008 silicone. So I'm going to cut this open, and we'll see what this is. This is what appears to be an intact implant. And again, you never know. If I take my ruler and I put it underneath, you will see how thin this is. No matter how thin, this was possibly going to be ruptured, and so all contained and everything inflamed, removed along with the implant capsule, including the probing suture. So now I'm going to go ahead and cut this open and remove. So not much stickiness here. This is your Mentor 450 intact implant and block. As you will see clearly, there's alloderm that was used. Suture material here, as you can see, a piece of it. So classically, what is alloderm removed on the right side? That's the yellow. And you can see how thin the capsule is. You can see my green glove, but it is, as you can see, not gone through. And this is why this is the end block. And you can see some areas relatively very thin. So, foreign material alloderm, foreign material the suture. What I'm going to do is I'm going to normally just I'll send this with the patient, which you can see in classic presentation of what is alloderm. I'm going to remove my top sterile glove, and I have a second glove sterile underneath. Left side complete total capsulectomy completely done. I didn't find any suture or anything like this on this side. And if I go so unusual to find alloderm in someone who did not have cancer reconstruction. So if I remove this, you can see that stickiness certainly present here. It was there too, but not, I saw it, but it was not likely captured on camera. 450 Mentor as well, intact implant. And I'm very happy and content with how the whole dissection has gone here. So this is regular tissue, and again, relatively very thin areas, as you will see, complete. Nothing that I see that's objectionable. So the implants will be returned to the patient capsules to be sent to pathology, rule out the PLLC, LCD30 analysis, rule out lymphoma, rule out malignancy, rule out abdominal pathology, cultures for Arabic and Arabic and fungals, and most importantly, you will see how the patient does post-op. The right side was literally super glued to the chest. The most important thing is to see the video of the chest wall showing complete removal of the capsule plus the implant plus all implant tissue. The chest literally had concave inward with the implant sitting tight on the ribs, and the ribs are always remodeling, and you'll see a nice contour deficit. Over time, her ribs are going to expand out, and that in itself will add some contour enhancement of the chest breast area. As she works out, she's going to add 10, 15, 20% muscle mass to her chest, regrow of the skin with the excess skin gone, fluffing effect of the breast tissue. Remember, the whole dissection was done below the muscle. The breast tissue above was not touched at all by me. And so we'll see how that breast tissue overall will expand as there is no implant in the proximity of the breast tissue, and now the breast tissue will have a chance to kind of fluff out, if you will. This is Dr. Khan, Executive Plastic Surgeon.